That's the world of addiction treatment. And that's, to me, that's a problem. And we have to stop blaming the patients because no doubt they have responsibility in this, but we can't put all of this on them when we are at a higher than 99% failure rate.
And you know as well as I do that for many people, the thinking around addiction doesn't seem to fit their experience, or they may have tried treatments that haven't worked for them.
The reason it's so problematic is the language we use around addiction in society at large reinforces this cycle.
This is only working when we're holding them in a space where we're controlling the entire environment.
If you're helping less than 1% of the people who have a problem, it's probably not their fault.
You mentioned your story.
At the age of 25, SWAT team, 8 o'clock in the morning on a Saturday.
Dr. Jaffe is a UCLA-trained psychologist, addiction expert, and best-selling author of The Abstinence Myth and Unhooked. Once facing 10 years in prison for drug trafficking, he rebuilt his life and went on to complete a PhD in psychology, becoming a nationally recognized voice on shame, addiction, and human transformation. Dr. Jaffe has been featured on CNN, The LA Times, Good Morning America, The Dr. Oz Show, and Larry King Now. Today, he blends cutting-edge research with radical compassion to help people unhook from unhealthy patterns, move through shame, and reconnect with purpose and joy. Get ready for a powerful conversation on addiction and what it truly takes to change.
Thank you so much for making the time to talk to me. Our listeners won't be aware of this, but we did record this session already. I had lost my voice at the time. My brain wasn't working properly, and somehow I didn't record the session. So thank you so much for making the time, because I really enjoyed our discussion, and I know that there is so much that listeners will take away from our conversation today.
Yeah, no, I'm excited. We'll call it, that was a dry run, and we'll do another. To be fair to you, I think it looked like it was recording. I think it was a glitch, and there was something weird that happened. So
Yeah, I think there was something we'd changed internet providers. But anyway, thank you so much for being here. So I want
yeah,
to jump in. You know, there are many ideas about addiction out there. So what addiction is, what addiction isn't, how we should treat addiction. And you know as well as I do that for many people, the thinking around addiction doesn't seem to fit their experience, or they may have tried treatments that haven't worked for them in the past. And in the book, you talk about why people may not have found success with past treatments. And I'm wondering if you can tell us a little bit about why this may be the case.
yeah. So, first of all, I want to parse out a couple of the things that you said. You said that for a lot of people, it doesn't fit their experience, and ironically, I think because we are influenced by the conversation around us, by the cultural understanding of everything that happens around us. Ironically, I think for some people, the explanation does end up making sense because it's the box that they get put in. And so what I mean by that is anybody who struggles with addiction and then is then told, hey, your brain is dysfunctional. It's the drugs are hitting this dopamine receptor in your brain. And I'm oversimplifying the conversation, obviously, but I think it is oversimplified oftentimes. The dopamine that is released because of the drug is short-circuiting your brain, and you lose control over your behavior. But it's a condition that you had. You actually had it before you even started using drug. You were born with an addicted brain or an addicted personality. You just didn't know it until you started using. We fit the experience into the explanation, right? Because it's better than what many of us go through beforehand, which is literally, we have no idea what happens, right? I've said this in many of my groups, but many people who struggle with addiction wake up in the morning not wanting to engage in the behavior, saying to themselves, I don't need it today. I'm going to make it through. And then by 8 o'clock in the morning, noon, 3 p.m., 7, midnight, they find themselves engaging in the same behavior again. And so they want an explanation, right? And the reality, I think, of life, and I'll use science as a sidebar for this, but the reality of life is that we learn why things happen around us. That gives us a reason, that gives us some predictability about the world around us, right? And so when we have this strange out-of-body experience of wanting to engage in one way, but then behaving in a different way, and somebody gives us an explanation, many of us hold on to it. And so I just want to call myself out as well. When I was studying addiction, even at UCLA, and was told that it was a brain disease, I bought it because that was, these really smart professors that were telling me all this stuff, and there was research to back it up. I fully bought it. So I think, unfortunately, we fit the experience to the explanation. It's almost like astrology, right? I'm not a believer, is, but like I'm a Virgo, and my wife will keep finding ways to explain to me why I'm a Virgo and send me posts. Some of them are right on, some of them are completely off. Most of them are moderately somewhere in the middle. If you looked at my office right now, the notion that I'm an over organized person who can't have anything out of place would very quickly be released from your brain, and you will never have to think about it again because it's just not true, right? I'm not super organized.
Mhm.
But there are aspects of being a Virgo that fit. So we fit our experience to the explanations that we buy into. And I think that's an important point to make because it leads into the second piece. The bottom line is the approaches we've had to deal with it haven't been successful at addressing the problem. And I think that is where I really doubled down, right? Because the reality of I'll talk about the US market just because it's one I know better. But in the United States, there are between 40 to 45 million people who struggle with substance use disorders because all the behavioral ones, technology, gambling, food, sex, we're not really good at quantifying those. I think there's close to 100 million people who actually struggle with addictions of all kinds. But let's just stick with the 40 to 45 million that are substance use related that SAMHSA, the Substance Abuse and Mental Health Service Administration, recognizes.
Mhm.
95% of those people don't even get treatment, which is unheard of in the medical community, right? If
Yeah.
of the people who get diagnosed with cancer, 85% get treatment. People who get diagnosed with diabetes, like 70 to 80% get some sort of treatment. Depression, 60, 70% get treatment. Somehow for addiction, only 5% of people get treatment. So that's number one. That's weird. Like why, if it's really a medical condition and it's explained by this thing, why is only 5% getting the care?
It's mind blowing. And I think, especially when you put it alongside, like, when you talk alongside cancer, you sort of go, okay, that's a medical model. But when you put it alongside depression and you're talking about 60 to 65, it's, similarly in that kind of mental health basket where we'd expect similar kind of barriers to access and support. 5%.
5%. And I think the thing, I would argue depression and addiction are at least on par in terms of the
Mm.
consequences they play out in people's lives. So it's
Mhm.
not like it's an inconsequential struggle. And so, okay, so only 5% of people are getting help ish, right? I mean, that different years, different groups, different substances. That's a good ballpark. Um, but then of the people who get help, 10, 15% actually find success given the treatments broadly that are available. So now only 5% of people get help and only about 5 to 10% of those succeed. You're talking about helping less than 1% of people who struggle with addiction. That's where the problem is, to my mind, because we're missing something. And the thing is that for the longest time, and I just got off a call with a client, so that conversation will probably inform the lens through which I explain some of the stories, but I'll use some of the stories from the book as well. If you're helping less than 1% of the people who have a problem, it's probably not their fault. What do I mean
Mhm.
by that? For the longest period of time, it said, well, people who have addiction, I hate using this term, but addicts and alcoholics, they don't want help. They're blind to their own problem. They don't see the issue. Okay. But, many people who have cancer don't see the issue until you identify it, until you have some lab test, an MRI, a CT scan that shows it, right? Many people who have depression don't recognize it as depression until they get some assessments and the professional gets involved. So that's true in all these other arenas as well. Why is it that somehow in addiction, we keep blaming the clients, the patients, for being the problem? And then it goes even farther because we certainly blame people with addiction issues for the failure of the treatment. So the treatment didn't work, you relapsed, right? You went to, let's say you spent all the money, you went to 30 days of rehab. 60-70% of people can stay abstinent for that period of time. So the rehab, quote unquote, worked. You stayed abstinent, right? You went to the house, you didn't drink. Now,
Mhm.
you know, there's not really drugs and alcohol in most of these places, so it's pretty easy not to use. But the moment people leave, I think the statistics are within 30 days, about 60% of people relapse. Within a year, about 90% of people. Uh, those stats change regularly, but let's say, again, ballpark. Why are 60% of people relapsing within 30 days? Did the rehab not do the work? Like, imagine if 60% of people were in remission from cancer while they were getting treatment, but within 30 days of treatment, the cancer would come back. I think we would say the treatment doesn't work. And so that's the world of addiction treatment. And that's, to me, that's a problem. And we have to stop blaming the patients, because no doubt they have responsibility in this, but we can't put all of this on them when we are at a higher than 99% failure rate.
I think that is just such an important point, and those numbers are just, honestly, they're so mind-blowing, because when you
Yeah.
work in this space and you understand how treatment works, and you understand that, of course, like, it's not a 100% success rate, but what we should be heading towards when you're talking about 1%, and you're talking about that in the context of, this is only working when we're holding them in a space where we're controlling the entire environment. So it's sort of like saying, we can treat depression for that 1 hour that someone comes and sits in the room with me. But then when they go back out into the world, the depression represents. That's
Yeah.
not an effective treatment.
Yeah. I think that's true. And I think, unfortunately, back to the explanation and the experience that we started with, the reason it's so problematic is the language we use around addiction in society at large reinforces this cycle. And so when somebody struggles with drinking, most people believe that they just need to stop drinking and everything will
Mhm.
be fine. If somebody struggles with gambling, we believe that if they could just control their gambling, everything would be fine. Heroin addiction, right? If you can just stop shooting up heroin, then you will be in remission from your addiction. The point that I make in my book is, and it's not, again, to be clear, I didn't invent this concept. I'm not the only one who says this, but what we call the addiction is actually the symptom. The addiction itself is the escape from underlying pain, discomfort, habitual past learning and models, things of that nature. And so people get trapped in this. I can tell everybody why the thing doesn't work. I think I know, and I don't think it's a secret. I think a lot of people know this. It's just hard to talk about. In the book, I use this behavioral chain, kind of like, why do we behave the way that we behave? And what I say is, um, there's a stimulus that happens, like you walk across your ex-girlfriend's house, right? That's a stimulus. You pass her house. The perspective, so it's stimulus, perception, activation, response, outcome. So stimulus, you walk past your ex-girlfriend's house. Perception is, oh my God, I lost the love of my life. I'm a loser. I'm always going to be alone. There she is, but I'm here by myself, right? That's the frame. That's the perspective you have on that experience of walking by her house. Memories start flooding of the time you were together and how you lost her. The activation is the physiological and the psychological response you have to that understanding of what just happened to you. It can be
Mhm.
anxiety, it can be fear, loneliness, shame, thinking you are unlovable. That's the activation. And it's that activation that is uncomfortable. That's a discomfort. The response is trying to address the feelings you just had. And so because you feel anxious, you learn, you know what, when I drink, I feel less anxious. I walk by my ex-girlfriend's house, I'm always going to be alone. I'm anxious. I'm going to go get a drink. So the activation is actually the thing that causes the response. But then after the response, you go to the bar, you drink, you black out, you act like an idiot, you get arrested. Everybody says, man, every time you drink, you get arrested. Stop drinking. And so people get caught in the cycle of, when I drink, bad things happen. So I need to stop the
Mhm.
drinking. And they try and they hold on, and we call it white knuckling, right? They try to hold on. And eventually something happens that causes strong enough activation where they need to drink again, because that's the only coping they have. And so they drink and the same cycle repeats. So people get stuck in the trying to address the response, but they forget all the stuff that comes before it. And so the forces that act on them towards, I'll call it maladaptive or negative behavior coping strategies, becomes too strong. They relapse. We look at the relapse as a failure. We actually look at it as proof that they're addicts and alcoholics and they just can't control themselves.
I love that explanation because it really does explain what actually happens rather than just this behavior outcome simplicity, which, I think people do latch onto because it's easy to understand. It's easy to kind of grasp that concept and go, okay, that's simple. We have a simple solution for, but it's not reality. And I think when I was reading your book, like the thing that I loved about that model is, and you used a few different pieces of language there, but the thing that stood out to me was coping, is that someone is trying to cope and using alcohol is one way of coping. And if we remove that one way of coping and we don't have anything else to use that's a more healthy, adaptive way of coping, how do we expect someone to sustain that change? And when I was reading your book, I was really thinking that this applies to everything. This applies to so many contexts outside of what we would traditionally think of as addiction. I think it's such a useful tool. And, I think that that is so important to understand because if we are, as you said before, in that 1% that's getting treatment, if all we're doing is removing them from the context, removing that one way of coping in that particular moment, and then sending them back into the environment where all the triggers exist, the stimulus exist, and we haven't provided new ways of coping, we have no understanding of why we are coping that way, it's very hard to maintain change.
Yeah, and so yes, and I also do agree. By the way, I developed the SPARO model because I was working with a lot of clients and they were bewildered by their own behavior, and so I kept trying to combine different models of behavior. So behaviorism is the idea that um, a stimulus happens, a trigger happens, it creates a response. The response gets rewarded or doesn't get rewarded, and so you either repeat the behavior or you don't.
Mhm.
That's kind of one of the old school models of why we do what we do. It was really, I talk about this in the book. It was really popular in the 40s and 50s. Think pigeons, you know, pecking at a switch and they get food. And the research, B.F. Skinner, that's known as the Skinner box, he would say, look, if I reward them hitting one switch versus another, they'll go to the switch that got rewarded, right? This one gives them food, this one doesn't. They're going to keep clicking this one, they're going to stop clicking that one. If the behavior is rewarded, they get something. He literally believed thoughts, feelings, etc. They don't even matter because it's whether you get rewarded or not. That flies in the face of addiction, right? Because it's pretty easy to see that many people, by the time they get into severe levels of addiction, they actually get punished oftentimes when they
Mm.
behave. So people start explaining, well, what is there instead? And that's when cognitive behavioral therapy and behaviorism never really caught on in therapy, but cognitive behavioral therapy came and said, no, 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 look, something happens, stimulus. You interpret it a certain way. That's the belief. And it's the belief that then creates the response. Okay. So now it's stimulus perception, essentially, by my language, response. But it missed a couple of things. It did miss the reward component because I think reward is important. Reward or punishment is important in behavior. And what it missed that we're so much more familiar with nowadays is physiological activation,
Mhm.
somatic theory, right? The idea that we at least partially respond to deal with the way our body feels. When you feel nauseous, when your chest feels tight, when you're shaking, right? These physiological somatic experiences, very well understood in trauma literature and things of that nature. You end up responding for that. So a sparrow was essentially me trying to put all those things together. Um, but I think you're right. We do this in our relationships, right? You respond to your partner based on an old model that you had that was developed long before you got into this specific relationship you're in right now. You do it at work. You respond to your boss and your colleagues based on the ways that you believe you're supposed to respond to people in specific settings. So the behavioral model just tries to explain why we do what we do. But I think the key is what I found is you show that to somebody who's struggling. And most of the time, not always, nothing is 100%, but most of the time they'll go, oh my God, now I get why I do what I do. And what I love about it more than the disease model is the unfortunate reality of the disease model. It's better than you're broken. It's better than you're a POS, for lack of swearing. Um, but it's permanent. Addiction is
Mm.
a chronic relapsing disease, brain disease. There's something wrong with you and you can never fix it. And I don't think that's true in addiction. And I've seen hundreds and hundreds of examples where that changes. But if you tell somebody that the condition they struggle with is unchangeable and they believe it, the odds of them actually being able to break through are minuscule. And I think that's one of the main reasons why we have less than 1% success rate in our industry.
Absolutely. And you talk in the book about this concept of hooks, which is a key component of understanding that individual experience. Can you talk a little bit more about that?
Yeah. I mean, so the reason I came up with the term hooks is because everybody says I'm hooked on cocaine or I'm hooked on pizza or I'm hooked on that TV show. I'm hooked on porn. I'm hooked on alcohol, right? And the idea is, again, it's the substance, it's the behavior that has its hooks in you. But when I take in my model things back, the hook are actually the perceptions and the activations that drive the behavior. So for an example, right, like in that example I gave before, you walk past um, an ex-partner's home. One of those hooks could have been that feeling of not being enough and being lonely and feeling that you're not worthy of love. Right. So that could come from a very early part in your life. It could have come from that specific breakup and what happened there. But what happens is people have these repeating hooks, and I talk about them literally. Like imagine the first time the thought came to your mind, oh my God, I'm going to be alone the rest of my life. Nobody loves me and they're never going to love me. And that sounds, I mean, I don't know if people can feel that as I'm saying it. Like when that belief is
Mm.
internalized, that's a really sad, upsetting state of being. And I say that's a hook, right? So it's like now that thought is in you and it literally hooked into you, metaphorically, psychologically. And so now anytime that hook gets tugged on, anytime a stimulus occurs that tugs on that hook, you get uncomfortable, you get anxious, you get scared. Oh my God, I'm going to spend the rest of my life alone. The activation is that anxiety I just mentioned, the fear, the difficulty breathing, the pit in your stomach, right? And so the hooks get pulled on, and we all have them. We all have hooks, right? And so they get pulled on. You need to respond. Some of us found really proactive, adaptive ways of dealing with the pain. We journal, we play music, we go for a run or a hard workout. We call our therapist or we talk to our best friend, right? Those are all ways of dealing with discomfort. We go see a funny movie, right? Those are still all coping mechanisms to deal with the discomfort that just came up. But some of us, and I share my story in the book and stories from other clients, some of us learn, oh, when that hook tugs and I have 4 or 5 drinks, I feel really good. And so we just keep repeating that cycle. And that's that rewarding thing that I was talking about before, right? So there's nothing, the behavior is not inherently wrong. It was a coping strategy that worked for the hook. The problem with it, and this is why I like to tell people, if you buy into this model and you like it and it makes sense to you, I just have to warn you ahead of time. It'll explain a lot of your behavior. That doesn't mean changing it is really easy because the work is difficult. The reason the work is difficult is the substance, the behavior really does relieve the issue that you're having. The problem is it doesn't actually make you better. It doesn't actually help resource you internally to deal with that struggle. So if I journal, there's some growth that happens out of that journaling when I feel anxious and I put pen to paper. I learn about myself, I get it out, I release it. If I drink, the anxiety, the fear, the negative thoughts are still inside of me. I just am not paying attention to them. The analogy would be if you broke your leg and you took a bunch of OxyContin, you don't feel the pain as much, but your leg is still broken.
Mm.
If the only thing you do for your broken leg is take some painkillers, your leg will probably not heal right.
I think it's so important to understand because you're right, like it is a lot of hard work, but I think when you explain it in that way, it sort of makes sense that, there is this short-term fix and yes, it does work. And I think part of the issue can be denying that. Like for a lot of people, the alcohol or whatever source of addiction they're using is actually on some level helping them to cope in that moment. But as you said, it's not addressing the problem and the pain remains. And so I love that analogy because I think that's really helpful and really helps people to grasp that concept that you're talking about.
Yeah. Yeah, I mean, what I try to do with a lot of the clients that I work with is just, I want to give them an explanation that tells them and relates to their actual experience.
Hmm.
Because just like they found their way into this, I think most people could find their way out. But there's a quote I think I end up using in the book where, you can dig a hole as deep as you want. If there's no water below where you are right now, that's not going to become a well, right? You have to dig in the right place. So
Hmm.
doing hard work matters, but you need to do the hard work on what actually will bring about change. And I'm not going to say that for somebody who has a drinking problem, not drink, like let's say somebody blacks out near daily, right? Not drinking will probably reduce substantial consequences in the short term, right?
Of course.
But if the internal pain, if the hooks are deep enough, painful enough, etc., that person will have one of two outcomes. I guess three. One, they will live quote unquote sober, but suffering for the rest of their lives.
Mhm.
They will find other ways of coping, or they will go back to the old coping mechanism, right? Those are really the only three options. So if we know that that's true, the only version that I hear in my own head, and this could be my bias, right? But the only version that I hear that is positive is that they have to find other coping strategies. And so if we know that that's part of the solution, and I say this literally in the book, then we have to work on parallel tracks. And I think this is where we fail most of the time. We have to help them slow down at least, if not stop the problematic behavior. But at the same time, we have to bring up their ability to cope. Because if we only stop one, we're actually hurting them. So that's the game. And that's why it gets difficult. And again, like I was just on a client call right before this, the resistance to pause your coping is massive because it's worked. And we know the statistics. On average, it's worked for 10 to 15 years. So you've been doing something for 15 years and using it as medicine. And now somebody's telling you you've got to slow down or stop. That's really scary. And I get that it's scary. The work is just worth it on the other side.
You mentioned your story. Can you share a little bit about, what's brought you to do the work that you're doing today and your experiences?
I was a well-functioning 14-year-old upper middle class family. When we moved, I was born in Israel, moved to the States, Chicago first. And I was always a little anxious looking back. I always had anxiety. Nobody really knew what it was because at 8, 9 years old, nobody asked me if I was anxious or nobody thought to ask me that. But there would be days where I would come back from school, literally leave sick from school because my stomach hurt so badly. I would be doubled over. They were looking for all these medical conditions. I not know I just had pretty substantial anxiety. And so I would
Mhm.
get these anxious panic attack like pangs and I couldn't stand up straight. My stomach would hurt a lot. So that started earlier in life. But then when I moved at the age of 14, my entire support network, all the friends that I'd had since the age of nothing were gone. I lived in the same neighborhood my entire first 14 years. And now I was in a new place. I was foreign. There were a lot of reasons why I didn't feel like I fit in. And I had massive social anxiety around that. So I felt I would always have terrible self-judgment about myself. Like if you and I were talking in a room and there were other people around, I would constantly be looking at what are you thinking about me? What does everybody else think about me? My mind was never quiet, always, always in self-judgment. And I didn't know to call it anxiety because nobody gave me language for it. But at the age of 14, moving to the States, I ended up going to the sleepaway camp. I talk about this in the book where as I'm sitting around at the end of the night, if anybody's ever been to a sleepaway camp, everybody gets together in one of the cabins, kind of low key, because you're not supposed to be doing it late at night. And it's 1 o'clock in the morning. We're all hanging out. And this kid pulled out a handle of vodka and was passing it around. Really warm, disgusting vodka. And it got to me. I already have social anxiety. I already want to fit in like there's no tomorrow. This kid's handing me some vodka. I'd heard of vodka. I never really drank it. I might have tasted some wine earlier in my life. I'm Jewish, so there's always wine in some ceremony. But um, I took the vodka and I took one big swig, and just to prove myself, I took another big swig, and it burnt. It was disgusting and I wanted to throw up, and I kept it down and I moved forward. Not even give it a second thought, to be honest, until about 20 minutes later, this really beautiful, warm feeling came over me. And with it, my anxiety just dissipated, like it just disappeared. And I'd never felt that before in my life. I'd never felt comfortable. And I was all in from that moment on. So every party on any given weekend after that day that I was invited to where I could drink, I drank. 2 years later, I got introduced to weed by this girl I had a crush on, and she handed me a joint. I was not going to say no to her, so I grabbed the joint. By the time I got to college, I was drinking alcohol and smoking every day. I went through a pretty bad breakup. My girlfriend from high school dumped me my first semester in college. And so I got
Aw.
even more uncomfortable, and I felt even more badly about myself. And so I looked for harder things to be able to fix the feelings, right? Because I never learned how to fix the social anxiety I had in high school. I didn't know how to fix this depression that was overcoming me. So drinking and using harder drugs became a regular thing for me. I ended up moving to Los Angeles, where I got exposed to more and more drugs. And by the time I was 21, my junior year of college, technically, I was using meth daily. I was also selling drugs because my drug use got very, very expensive. So I started selling drugs, and I barely graduated college, and I essentially drug dealt for a living. But I was high definitely from the day I went to college till the day I ended up getting arrested at the age of 25. I had 4 arrests, but the big arrest was at the age of 25. Um, I would say I was probably not sober for 1 day. I might have missed a day or 2 in there, but I just used drugs the entire time. I actually stopped drinking at some point in the middle because the drugs did a much better job for me. So just high at every single moment. I opened the book with the story of a SWAT team arrest that came to get me after an accident that I'd had. And so at the age of 25, SWAT team, 8 o'clock in the morning on a Saturday. And that was kind of like this sign from the universe after many, many other signs that the way I was going could not continue. I'd known enough other guys who sold drugs where I was either going to die or I was going to spend the rest of my life in prison. And I didn't know what to do with it. And so what I did was my lawyer recommended I go to rehab. I did. I got kicked out of the first rehab for using, went into my second rehab, and went through a lot of tumultuous times to just figure out how to get quote unquote right. And the main purpose for me was really just to stay out of prison because I was facing about 15 years. I ended up getting an 8-year sentence, but it's called a 1+7. So 1 year plus 7 suspended. The idea was you have to do 1 year. If you screw up at all, you have 7 years added to whatever else you do later. Fortunately, I was able to stay on the straight and narrow path, but I had to spend a year in jail to do that. So after rehab, I went to jail for a year. When I got out of jail, I had no skills other than drug dealing. I had barely graduated college. And so I went to look for a job, but I had 9 felonies on my record. And so nobody would hire me. I looked for work for about 9 to 10 months. Couldn't get a mall job, couldn't get a pizza delivery boy job. Nobody would hire me. So I ended up going back to school literally because it was the only other path in front of me. And I wasn't planning on this, but when I went back to school, because of the advisor that I got connected with and the psychology degree that I'd had, so I went to graduate school for psychology, almost immediately I got really interested in learning what the heck happened. Like, how did I go from a pretty regular kid to a gun-toting drug dealer in LA? Who's 124 pounds and smoking meth all day, every day. So really, I ended up spending the next 7 years getting my master's and my PhD, studying the neuroscience, genetics, clinical psychology, abnormal psychology, social psychology, everything I could to wrap my head around what happened to me. But in the interim, I got really, really interested in addiction at large. And so that was this launching pad for me. And eventually, as I started figuring it out for myself and my life started getting better, I decided I wanted to go help other people.
This conversation was so interesting and there was simply too much to unpack in one episode. So we kept the conversation going. Look out for part 2 coming next week. Subscribe for more conversations filled with new insights, inspiration, and practical tools to create a life you love.